I would say my people, the people that I have hired, they're qualified people with a heart.
Aside from just the loving care, they're very competent. The nurses have been here. We've been open 22, almost 23 years. Many of our nursing staff have been here almost since the day that we opened. The average turnover in the nursing home industry is really 100%. You turn over the entire staff inside of a year. We have the best retention rate in South Florida, which provides the continuity of care, provides the experience.
The thing that stands out is the type of person that work here. Definitely they really care about the patient. And again, I'm telling you about the simplest thing that you could think of. Oh, they got a stain on the shirt, or something smells funny in the room. From the simplest thing, they do care about the patient, okay? That in itself make it different from other places. I go to different places, but Waterford got that particular, what do you call it, characteristic that you don't find everywhere else, okay? They care, they get involved with the patient, and they get involved with the family. That in itself makes a big difference in patient care.
The rounding program is a balance and check of our programs in the building.
Basically, clinical care is a team approach to patient care. If we're talking about a patient that is not feeding well, is not eating well, we get the speech therapist involved, we get the dietitian involved. We get a patient that is having some behavioral problem, we communicate to the nurse communicate to the physician, and maybe get a psychologist or the psychiatrist involved.
One perfect example is nursing. One of the things that we check in nursing is how the resident looks like, how the skin looks like, how the oral care is being done, and how the environment of care is being maintained.
A good example that I always use, you got somebody with a headache, you give them aspirin and that problem is solved. The problem is not solved. You have to find out what's causing the problem to either solve the problem from the base, from the root of the problem, or prevent the problem from happening altogether.
We have resident council meeting in our building, and there we try to elicit some concerns and recommendations from them, starting from food, starting from whatever activities are being provided for them in the community and in the facility. The family council meeting is similar to the resident council meeting. Whatever the family finds, whatever the family's concerns are, and the recommendation that they would like to give to the facility.
Nobody knows the patient better than the family. Even I have patients that have been here for years, and sometimes when something's going on, it's very subtle. They catch it way before I can catch it because they know it. They know the patient, they know how they behave, and they usually inform us what's going on.
And Lorne is a great nurse. I mean, she's a great hands-on nurse, and she demands perfection. Even though there's a nursing shortage in all of the country, especially South Florida, she won't settle for anything less than quality care, and she raises everyone's level.
Her main concern, her major concern, and probably the only concern she has is the patient. How the patient is going to react, how the patient is going to feel, how the patient is going to improve. Okay? And when we talk about patient, again, we talk about the whole thing. You have to think about the patient, not only the patient that you're looking at, but the family involved with the patient. So whatever decision you take or you make to take care of the patient, you have to think about the family, and that's something that she always does.
We would like to be known in the community as a compassionate servant leader for our residents, our staff, and the community that we serve.